Middle ear infection, which is a disease, is quite common and is found in many patients. First, where the eardrum is fine and water has gathered behind the curtain. There are many reasons for this. The most common reason is that the cold or the infection of the nose goes to the ear through a tube. This is called secretory otitis media, and sometimes it lasts for a long time. The patient's hearing is less and sometimes there can be ear pain also. The second middle infection is called acute suppurative otitis media. This is an acute condition. The patient comes with severe pain. Initially, these patients are given antibiotics, decongestant medicines, and drops in the nose to control this infection. And if the patient does not respond, then many times pus has to be removed through a small operation called myringotomy. The other type of middle ear infection is called chronic otitis media. This is of two types. One is where there is only a hole in the eardrum, which is called the safe type. The other is where there is bone erosion. If the ear bone, which is the mastoid bone, melts, then it takes the form of unsafe CSOM or cholesteatoma. In such patients, there is a discharge from the ear and sometimes it has a foul smell and it continues for years. The patient's hearing power reduces, and if it is not caught at the right time, it can cause further complications like facial nerve paralysis, meningitis, brain abscess, and neck abscess. So, it should be diagnosed at the right time and treated. If such a patient comes to an ENT surgeon, then he checks the ear. After that, the patient's hearing test is done. An X-ray of the mastoid bone or at times CT scan is done to see the level of the disease, how far it has spread, and the hearing loss. After determining everything, a 2.5 to 3 hours operation cleans the entire mastoid bone, constructs a new curtain, and reconstructs the auditory bones in the ear if feasible. This surgery is called tympanομastodectomy. Dry the ear first if there is only a hole in the curtain, which is done with the help of medicines, decongestants or ear drops, and then the curtain is made. This operation is called tympanoplasty and its success rate is more than 95%. So middle ear infection is common, it happens in many patients, but this is correctable and treatable, so getting proper advice, getting proper tests done, and then proper treatment is very important. And if you do not get it treated at the right time, then the ability to hear gradually deteriorates. The ear will continue to discharge fluid, which is a nuisance for the patient even in social gatherings and can lead to complications, which is a special unsafe type of CSOM. Our advice for this is that if someone has hearing loss, ear discharge, and nose infection, then show it to an ENT surgeon, get it diagnosed, and get it treated properly. You can find a solution to this. To prevent middle ear infections while bottle feeding a baby, the mother should ensure that the baby is sitting in a slightly upright position. Avoid laying them flat or letting them sleep during feeding, as milk can enter the ear through the eustachian tube. Correct positioning is crucial. If there is discharge from your child's ear, do not take it lightly. Take medical advice on this because it can lead to a bad disease. If someone catches a cold and it happens again and again, then get it treated immediately. Do not let it go on for a long time because this is the source of ear infection. The third thing is socioeconomic status. Ours is a developing nation, wherein there are prosperous people as well as poor people. The socioeconomy status is low in many places and the hygiene is not very good. It has been observed that CSOM, chronic suppurative otitis, is found in crowded areas where more people are living in one room and hygiene is not very good. The next important thing is not to use earbuds regularly. Don't scratch your ear again and again. If you have a problem, let the doctor see you and give medicines. If you use a bud, not only can it damage the outer part of the ear, but it can also damage the eardrum, and that again leads to CSOM. Other than this, If you are having pain in your ear, again and again, there is heaviness in the ear, do not take it lightly. Even though your eardrum is intact but the infection is settling behind the scenes, which can cause problems for a long time later. Loss of hearing, discharge from the ear, and related symptoms require immediate medical attention and appropriate treatment. It's crucial to act promptly for better outcomes and take necessary measures to address these concerns.